Hello everyone, myself Ganesh Govind Saraskar, and today we will discuss antimalarial drugs. And among these drugs, my topic is quinine and artemisinin derivatives. So let's discuss briefly the introduction. We know that malaria is caused by the protozoal parasite called as Plasmodium, that is transmitted by the vector called as female Anopheles mosquito. Malaria is the major health problem in India and tropics, and it is caused by the 4 species of Plasmodial parasite. These are Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, Plasmodium malariae, and recently one more species have been discovered, that is Plasmodium knowlesi. And among these species, Plasmodium vivax, ovale, falciparum causes tertian malaria, and Plasmodium malariae causes quartan malaria. In tertian malaria, the fever recurs on every third day, and in quartan malaria, the fever recurs on every fourth day in infection. Now let's discuss briefly the life cycle of Plasmodial parasite. We know that the causative organism of malaria is Plasmodium parasite, and the vector or definitive host is female Anopheles mosquito, and the intermediate host is man. We know that definitive host is the host in which sexual life cycle of malarial parasite takes place, and the intermediate host is the host in which asexual life cycle of malarial parasite takes place. The life cycle occurs partly inside the mosquito called as sexual sporogony, and partly inside the man called as asexual schizogony. Mosquito bites to the man and transmits the sporozoites to the human blood. The sporozoites then enter the liver and reproduce asexually, producing merozoites. Merozoites infect new RBCs and initiate asexual multiplication. That leads to production of more merozoites. The RBCs burst and starts the infective cycle. And it is important to note that it is at this stage that is the symptoms of malaria, which are fever, chills and rigor occurs. Then some merozoites develops into male and female gametes. Some merozoites remain dormant in the liver called as hypnozoites, and which will be responsible for relapse cases in later stages. When mosquito bites the infected person, gametes are taken up with the blood meal. The gametocytes mature in mosquito's gut and fuses to form okinete that develops into sporozoite. It is called sexual sporogony. The sporozoites migrates to the salivary gland of mosquito and infects the new host when mosquito bites the person. Then what is recurrent malaria? We have seen that the hypnozoites or dormant stage of Plasmodium parasite in the life cycle that is responsible for relapse cases of malaria. It is due to the non-clearance of malarial parasite from the patient's body due to the incomplete treatment by patient. Then objectives of use of antimalarial drugs. Antimalarial drugs are used for prevention of clinical attack of malaria, that is prophylactic treatment, to treat the clinical attacks of malaria, that is curative treatment, to completely eradicate the parasite from the patient's body, that is a radical cure, and to cut down the human to mosquito transmission, that is gametocidal treatment. Then let's see the antimalarial drugs. The drugs which are given for prophylaxis, treatment and prevention of relapse cases of malaria are called as antimalarial drugs. Let's see the chemical classification of antimalarial drugs, and our main focus here on cinchona alkaloid, that is quinine, and sesquiterpene lactone derivative, that is artemisinin derivatives. These are artesunate, artemether, arteether and arterolane. Now our first drug, that is quinine. Quinine is the levorotatory alkaloid obtained from cinchona bark. Its D-isomer quinidine is used as an antiarrhythmic drug. It is also used for malaria in other countries. Quinine is an erythrocytic cygenticide for all the species of Plasmodia, but it is less effective and more toxic than chloroquine. Quinine is still used due to the fact that most of the chloroquine and multidrug resistant strains of Plasmodium falciparum still respond to quinine. There is partial cross resistance between quinine and mefloquine, but many mefloquine resistant cases respond to quinine. Quinine is effective in terminating acute attack of falciparum malaria, but quinine may not prevent the relapse cases, indicating incomplete parasitic clearance from the patient's blood. So, doxycycline or clindamycin is mostly added to quinine for the complete parasitic clearance. Quinine has no effect on pre-erythrocytic stage and on hypnozoites of relapsing malaria, but it can kill the vivax gametes. Now let's see the mechanism of action of quinine. Like chloroquine, it is the weak base and acts in the similar way to inhibit the polymerization of heme to hemozoin. Free heme or heme quinine complex damages the parasitic membrane and kills the parasite. However, the exact mechanism of action for quinine is not known. The resistance to quinine in Plasmodium falciparum appears to involve both enhanced translation and mutation of PFMDR gene among the different strains. See the mechanism of action. We know that hemoglobin on breakdown gets converted into globin and heme portion, of which globin is utilized by the malarial parasite, and heme portion, that is highly toxic for malarial parasite, is further converted to hemozoin in the mosquito. And this stage requires the enzyme heme polymerase, and at this stage the quinine acts by inhibiting the polymerization of heme to hemozoin. Quinine has many other actions. It is the local irritant and anesthetic. It is intensely bitter and irritant. When given orally causes nausea, vomiting, epigastric and discomfort. When given in injection causes pain, local necrosis in the muscles and thrombosis in vein. It also causes local inflammation followed by fibrosis. The systemic actions of quinine. Gastric secretion is increased. Quinine is the weak analgesic and antibiotic, affects hearing and vision at higher doses. Cardiodepressant, antiarrhythmic and hypotensive actions of quinine are similar to quinidine. Rapid IV injection can produce marked fall in blood pressure and cardiovascular collapse. It stimulates myometrium and causes abortion in early pregnancy. However, it is not dependable abortifacient drug. Blood sugar is slightly lowered due to release of insulin from the pancreas. Rapid IV injection can cause hypoglycemia. Now let's have a look on pharmacokinetics. Quinine is absorbed rapidly and completely by oral route. It is 70% bound to plasma protein, especially alpha-1 acid glycoprotein that increases during acute malarial infection. Its CSF concentration are low. A large fraction of dose is metabolized in liver by enzyme CYP3A and excreted in urine with the half-life of 10 to 12 hours. Now the adverse drug reactions of quinine. Quinine causes synchonism when given in large single dose or higher therapeutic doses for longer period of duration. Synchonism is the group of symptoms that includes tinnitus, nausea, vomiting, headache, mental confusion, vertigo, difficulty in hearing and visual disturbances. Often diarrhea, flushing and marked perspiration is also seen with quinine. When given in still higher doses, exaggerated symptoms with delirium, fever, tachypnea, respiratory depression, pulmonary edema, hypoglycemia is also seen. Idiosyncrasy in some individuals is also seen. Synchonism develops at therapeutic doses itself. Occasional hemolysis in pregnant women and patient with Plasmodium falciparum leads to hemoglobinuria, that is black water fever and kidney damage. Now uses of quinine. Quinine is used for malarial treatment, that is in uncomplicated resistant falciparum malaria. It is given by oral route of administration when ACT not available. And it is also used for complicated and severe malaria, including cerebral malaria. Actually, quinine is a drug of choice for complicated and severe malaria. It is given by IV route. The other drugs like artesunate, artemether, arteether are also given intramuscularly along with this quinine. Then it is also used for nocturnal muscle cramps. Now our second drug, that is artemisinin. Artemisinin is the active principle of plant Kingasu, that is Artemisia annua. It is a sesquiterpene lactone derivative, most potent and rapid acting against blood sygenticides of Plasmodium falciparum resistant to all the other species or all the other drugs. Potent and rapid sygenticidal action causes rapid parasitic clearance from patient body. It is lethal to early gametes but do not kill primary liver forms of hypnozoites. Due to its shorter duration of action and often used as a single dose therapy, it has high recrudescence or relapse rates. Now, mechanism of action of artemisinin. These compounds have presence of endoperoxide bridges. Endoperoxide bridge interact with heme in parasite. Heme iron then cleaves this endoperoxide bridge. There is generation of highly reactive free radical species which damage the parasitic membrane by covalently binding to the membrane protein. The drug protein adduct which is formed as a result of this is also known to cause the lipid peroxidation and endoplasmic reticulum damage of the Plasmodium parasite. Then adverse effects of artemisinin. The mild adverse effect like nausea, vomiting, abdominal pain, drug fever, itching is seen with the artemisinin. Tinnitus, dizziness, bleeding, dark urine, ECG changes, that is QT prolongation or torsades de pointis, and rarely leukopenia is also seen with artemisinin. Now the uses of artemisinin. It is used for uncomplicated Plasmodium falciparum, that is chloroquine sensitive as well as resistant species. It is also used for severe and complicated malaria, and it is given parenterally. Then artemisinin derivatives. Artesunate, artemether, arteether are the commonly used artemisinin derivatives. Then what is artemisinin based combination therapy? Artemisinin based combination therapy is used for antimalarial drugs, as these are the fastest acting antimalarial agents. Artemisinin compounds are shortly acting drugs. Monotherapy needs to be extended beyond the disappearance of parasite to prevent the relapse cases. And relapse can be prevented by combining artemisinin compounds with one of the longer acting drugs like mefloquine or lumefantrine. Why to use combination therapy? Because it causes rapid clinical and parasitological cure, higher cure rates and low relapse rates because of absence of resistance, and a good tolerability profile. We have to use the ACT, that is artemisinin based combination therapies. Then artemisinin based combination therapy regimens in use. These are artesunate sulfadoxine pyrimethamine, artesunate mefloquine, artemether lumefantrine, artesunate amadiquine, arterolen piperacquine. These are commonly used ACT regimens. Now let's see few MCQs on this topic. The drug of choice for patient with severe complicated malaria is option C, artesunate. The most effective treatment for severe malaria is yes, option A, artesunate. Which of the following can cause hypoglycemia in the patient of severe cerebral malaria on treatment? Yes, obviously option A, quinine, we have seen in this PPT. The drug of choice for chloroquine resistant Plasmodium falciparum malaria is option A, quinine. And the last question, drug which is not given for malaria prophylaxis is, that is artesunate. Artesunate is not given for prophylaxis of malaria. So thank you guys, have a good day.